This is the Pediatric Neuroradiology reading room. It's in very close proximity to our Pediatric EMU or monitoring unit. It's in very close proximity to our Neurology PICU as well as our regular PICU. So on a frequent basis, whenever we have any question regarding films on our patients, we can walk down here with the team and read them directly with one of our pediatric neuroradiologists. This provides an excellent means of communication regarding the whole team between what we see on the images, what the radiologists are seeing on the images, and allows us to really make day by day and even hour by hour changes depending on what the imaging shows us. It also informs the neuroradiologists on what the clinical history is, how it's relevant to the images that they're seeing, and provides that really close communication and patient information coupled with the high technology that we have available. I'm going to introduce you to Dr. Linda Heyer. She's our head of our pediatric neuroradiology, who can give you a more in-depth view of the high degree of technology that we have available in our department, as well as the close communication we have regarding our team.
The neuroradiology department has some 6 magnetic resonance imaging machines. Our high-resolution magnets are 3 Tesla. We have 3 of them. We have MR spectroscopy available. Our epilepsy protocol is a standard high-resolution SPGR analysis of the brain, which particularly directs attention to the temporal lobes and looking for cortical dysplasias. These can also be addressed by using magnetic resonance spectroscopy, another technique that we can use to identify abnormalities in the brain. There are also functional uses for magnetic resonance imaging. We can look at the areas of epilepsy that are matched with both motor and speech difficulties by using functional imaging with other high-resolution tractography. We can identify where the imaging abnormalities are for the surgeon, and thus he can protect areas of eloquent brain. Other things that we can do are PET imaging, which allows the area of epilepsy to be determined by PET scanning, and this is a injection immediately during the seizure, and we can identify the area that is hot on the brain where the seizure focus is occurring, and we can often correspond that to the MR abnormality that we see on our usual sequences and match it back to the electroencephalographic findings. Once the seizure focus is found, we're able to use many imaging modalities to identify the exact location in the brain so the surgeons can protect eloquent areas they wish to avoid. And some of these items include functional MRI to identify where the motor strip and the language areas are, and this can be combined with diffusion tensor imaging, which provides tracking of the white matter. So you can identify where the hand works, for example, and then the white matter tracks that take the fibers into the brainstem, and these can be all mapped on our brain lab server and identified for the neurosurgeon so that they avoid those areas when they go to resect an area of cortical dysplasia. So this combination of the functional and DTI has been a new innovation in the last couple of years and has made neurosurgery for epilepsy much safer with better outcomes.